Okay, so let's talk a little bit about this. Breast Cancer Awareness Month. I think we've all heard that there are risk factors for breast cancer, but maybe people don't know how to minimize those, how to take down their personal risk of breast cancer. Can you talk a little bit about that?
So the greatest risk of getting breast cancer is having a genetic mutation that predisposes you. There is nothing you can do about that. That's in your genes. But it's important to be aware if it is. To reduce your risk, though, every woman can be within a healthy weight. Obesity does increase your risk of developing breast cancer that is sensitive to hormones. Fat stores produce estrogen. Estrogen feeds some breast cancer. So obesity is definitely a risk factor. Alcohol intake has also been associated with increased breast cancer risk and recurrence, and that's because it's thought because the liver is an organ that cleans up a lot of impurities in your bloodstream. So if you have a high alcohol intake that affects your liver, that might impact the cleaning up that its role is. Smoking, although it's not a direct cause of breast cancer, it does just diminish your overall health. So not smoking, if you do get diagnosed with breast cancer, is going to help your treatment and recovery. So those three are things that we definitely have control over.
And I think they seem like very basic things that we take for granted, but they've got to be done. Like, it's the work of having a healthy body, staying fit, monitoring how much alcohol you take in, not smoking. These are like, you could say those about a lot of diseases right there. I mean, heart disease, cardiovascular problems, it's amazing.
Yes.
Breast cancer is almost exclusively, not exclusively, but almost exclusively a women's disease. About 1% of men develop it. What is that to do with?
1% of breast cancer that is diagnosed is in the male population. So men have breasts also, and that's a common misconception that men can't get breast cancer. They can, because they have the same breast cells, although in much minimal and less functional amounts than women do. So the ducts and the lobules are, the nipple and areola are on men also, but it's just a smaller volume, and it's just not as common, unless, again, you have a genetic predisposition to breast cancer, and then men can
as well. And if you have the genetic predisposition, obviously you can't do anything about that, but the awareness, the early detection, the regular checkups, those can all help more positive outcomes, right?
Well, you actually, when you have that knowledge, you can do something about it. And what women are doing is starting earlier, very close surveillance with their breast surgeons. And some women do take the dramatic decision of removing their breasts before they develop breast cancer. So some women have an up to 90% chance of developing breast cancer, and early in their 30s and 40s. So that's a personal decision whether you proceed with close monitoring at that point or you do a prophylactic surgery to remove that potentially, that tissue that will potentially
become
develop
cancerous.
Cancer.
So this really gets into what you do, and you're part of this process.
Yes.
Talk to me a little bit about the emotional side of this. We talk a lot about chemotherapy, we talk a lot about radiation, surgery, treatment. After the treatment is over, I think part of, for a woman, of reclaiming her identity and her sense of self may have to do with the reconstruction.
Yes, and that's the very satisfying part of my job, is that I can offer women such amazing reconstructions, in some cases better than the breast tissue they already have. And that really helps them make their decision, because there are a lot of options in breast cancer treatment, whether it's removing part of the breast, a whole breast for cancer treatment, or before you get cancer. The ability that I have to offer really amazing reconstructions, which is very different from what we were doing 20 years ago even, just helps women make that decision to go forward with treatment.
How is it different doing a post-cancer or post-operative reconstruction than whatever the ads we would see on the subway for breast augmentation, for breast reconstruction?
So those are very different. One is a cosmetic. Breast augmentation or reduction can be done for cosmetic purposes. The reconstruction that I do is for disease process.
Right.
A lot of times it's not an option, so you have to proceed with breast cancer treatment, and surgery is the main treatment, but at least this way I have very good options for women to restore their breast image and their body image as well.
We say cancer-free when my mom has been cancer-free for a number of years, but that's not necessarily cancer-free for life.
Right.
If you've had cancer, you have to continue monitoring going forward. Is that right?
Yes. Generally, women that are treated in breast cancer centers continue surveillance with their breast care team, usually their breast cancer surgeon, even oncologist. And if they have the other breast still in place or a portion of their breast still in place, they're still going to be getting mammograms, they're still going to be getting surveillance, other imaging studies. Even if you have both breasts removed, you still need to be monitored with self-breast exams because there is a very small chance of recurrence, but it can happen.
You've obviously experienced a lot of amazing stories in your career. Do you have any that stick out in your mind?
I could be here all day, but probably the three most. I think the younger women diagnosed, just because we have such good surveillance and early detection now, women are diagnosed younger and younger. One of my first patients when I was in practice 5 years ago, I was in San Francisco. It was a young patient, early diagnosis, who did not have health insurance. So the breast surgeon I worked with asked me to help her with her care, which I obviously did. And it has happened that she was a nun, and the surgery happened to fall on Ash Wednesday, so I definitely thought that was a sign from above that I was doing good work.
Good, yeah.
And she actually came to see me. She needed more surgery and came to see me when I was here in New York, and we're friends. When I go to San Francisco, I see her.
I love it. It's a great
That's a
story.
great one.
It's a great story, and you are. And I think we need more people like you who look at a patient and see a human being instead of a chance to write a bill. You know what I mean? We have so many problems with that in our country, and so thank you for doing that, and thank you for being here and talking about this today. It's
Thank
such
you.
a good thing. And thank you for being here and for listening to this conversation. Breast Cancer Awareness Month, I mean, I know we hear breast cancer all the time, but awareness means having these conversations, not just here, but hopefully then you will have them at home as well, because it is, like the doctor said, like Dr. Nawila said, it's about surveillance, it's about early detection, it's about taking care of yourself.